Hello, my name is Dr. Eli Tabari. I'm an oral and maxillofacial surgeon, and I thought about doing this live feed because at this time a lot of people don't have access to their oral health care, and because of the COVID-19 and the lockdown of what's going on. So I thought it'd be a good little shtick to kind of present a live feed on things that maybe people are concerned with, or maybe concerned with, but they don't have the access at this time to go see a healthcare professional that's treating oral healthcare, their dentist, their dental specialist. So this is a little, little information video of what I could give to you guys, whether things could be an emergency, they need to be seen right away, or whether they could wait till things settle down a little bit. Want to start off by saying what defines an emergency. That's also a questionable topic, but usually if you have pain, if you have swelling, if you have excessive bleeding, those are emergencies. Those need to be brought attention to. Also, sometimes questionable emergencies. Let's say you have a bad taste in your mouth. Maybe an infection could be brewing, possibly. There are things, however, that we see a lot as dentists and dental specialists, oral surgeons, periodontists, that could wait. They're not emergent needs, but sometimes patients, when they see these things in their mouth, they think that they need to be treated right away. And that's where I'm coming from today. To kind of give you at home, if you're noticing anything, give you an idea of, oh, this needs to be treated, this should be treated, or I could wait. But as I said before, tell signs of something that needs to be treated. I mean, if it's giving you pain, it's giving you pain. There's no bargaining with that. If you have swelling, if you have bleeding, sometimes a bad taste in your mouth, sometimes you might feel like heat in the areas of your oral and facial region. These are things that possibly need attention, even though we're on lockdown. At any rate, having said that, before I begin, I want to let you know that I am an oral and maxillofacial surgeon, and I am here to treat emergencies in basically pretty much the greater LA area. My office is in Westwood, but I do travel to other offices and do their oral surgery. And if there's an emergent case and a patient can't find anyone that's going to help them, I am available. Also of note is that I do have a lot of dental friends, and from what I understand, a lot of them are available to treat emergencies. And you could direct message me if you have questions, concerns, or if you need to be seen, or if you need to be seen by a dentist, because I have a lot of dental friends, like I said, that will see emergencies at this time. Having said that, let's move on to some things I want to discuss, some things that I see regularly a lot, and you could ask questions, or if you don't want to ask questions at this time, you could, as I said, direct message me. But if you can see this picture, this is, you start very, actually, the most common disease affecting human beings is dental caries, a tooth cavity, as it is known. So at this time, you have a tooth that may look like that. Hope you could see this well. Of course, we're just on Facebook Live, but you have a tooth that's broken, or it's obvious it has a cavity. Now, the thing is, sometimes they don't hurt. You could have a cavity, you could have a broken tooth like this here. It could be asymptomatic. So the question is it an emergency? That is kind of questionable. I mean, do you risk seeing a healthcare professional, oral healthcare professional, and possibly getting the COVID-19 virus? I think where we draw the line at this time would be if it's painful or not. Because if you have pain, you have pain, and it needs to be treated. Now, a cavity in the tooth, as common as it is, and it's the most common disease worldwide, a cavity in the tooth can be limited to just the enamel or dentin of the tooth, or it could spread to the pulp areas of the tooth. And when it does that, when it spreads to the pulp tissue, that's when you need a root canal to fix it. So if it hasn't spread to the pulp, maybe you could get away with what I term drill and fill, meaning you see a dentist, they drill the cavity out and they fill the tooth, pain will hopefully subside. If it spreads to the pulp, then you need a root canal, which is more extensive procedure, usually done by root canal specialists. And they basically take out the pulp of the tooth, which contains blood vessels, nerves, pain mediators, and they debride the pulp tissue and put a biological material instead of the pulp tissue. So that is common thing. A lot of people have dental caries, cavities as lay people call them, and sometimes it could be an emergency and it may need treatment. Okay, we move on to what's called a dental pearulis. Now, sometimes you have in your mouth something that looks like this. It's like a little boil in your mouth. Now this is when that dental caries has traveled not only through the pulp, but has traveled through the connective tissue in your mouth, including bone, and has created a fistula tract that comes outside and presents as this boil type lesion on your gingiva. The weird thing about this, sometimes it doesn't hurt. You wake up seeing this and you don't know what's going on. You don't know if the tooth is infected, where this came about, and that's when I see patients, they are kind of curious as what this is. So what happens, as I noted before, the cavity, like I said, cavities can sometimes not cause pain. So they go into the pulp tissue and they lead through the roots, they go through outside the roots of the tooth into the bony structure, into the gum tissue, and they lead to a boil-looking lesion that looks like that. Usually they do present with a bad taste in your mouth because there could be purulent discharge draining into the oral cavity. Now, what do you do at this point? Well, you need to get that treated because it's an active site infection and it's a fistula. So usually these do need at least a root canal. Sometimes a root canal may not even save them and the tooth needs to be taken out. That depends. If most of the tooth structure is gone and the infection is at the bony level, then most likely the tooth needs to be extracted. But I would contend that this presents as somewhat of a dental emergency because you have a draining infectious tract, even though sometimes it could be asymptomatic because basically the pressure buildup that would normally cause pain is being resolved because the tract is leading to outside the tissues, so there's no pressure buildup, and that's why sometimes it doesn't cause pain. However, there is an infection running through a tract, and a lot of periodontists and what have you would contend, and there's been studies that you can't have just an active infection in your mouth even if it's not hurting you or causing symptoms, because it could lead to some kind of bacteremia that could affect your heart valves, cause heart disease, and what have you. Moving on, so if you see this in your mouth, you don't have pain, keep in mind it could be an infection tract that's happening because of an infected tooth. Okay, our next case is, and we're continuing this line of dental infections. As I noted, it could just infect the enamel or dentin of the tooth. At that time, it could be treated with a filling, basically. Then, if it gets further into the root of the tooth, then you have the tooth may need a root. Well, most will need a root canal. If it spreads to the pulp tissues of the tooth, and pretty much the infection spreads to the bone level of the tooth, then pretty much it needs to be taken out. As this primitive picture shows, if it's spreading to the bone level of that tooth, the tooth pretty much needs to be taken out. Usually this will be better represented on an x-ray. I did not want to bring x-ray radiological images today, because if you have an x-ray, you're already probably seeing a healthcare professional, and you don't need my 2 cents at this time. This is for people that don't have access or choosing to stay home because of the COVID-19 lockdown, and they're just concerned and they want to know if they should see an oral care professional or not. And by the way, if you have any questions, I'll be happy to answer them, either through now or if you want to DM me later on. But now let's take a look. If you see this picture, this is kind of a mild case, but this is a case actually I had treated yesterday. But you see that there's swelling and redness in the face. A lot of times it's much worse than this. This is a mild case, but just for the fact that I treated this recently, I chose this picture. The swelling now has gone past through the root, the tooth structure. It's not draining through a fistula like the previous case. It's actually infecting a facial compartment, and that's where you're seeing this swelling. This little cartoon diagram kind of shows the image of what's the picture of what's going on, where the infection now has traveled past the bone and is infecting it's located in a facial compartment, and that's where you get the swelling. You might also have the area having redness, being hot to touch, and this is definitely an emergency. Reason being, because you have a facial swelling, and if this continues, it could cause airway problems. Whenever you have airway problems, bad. It could prevent you from adequately breathing if not properly taken care of and treated at a definitive amount of time. So these definitely constitute a dental emergencies. Usually, if you have tooth pain, as well as you wake up with a swelling like this, most likely it's probably from that tooth, where the infection has gone through the pulp, through the tooth root structure, through the bone, and has infected the facial space area. However, a lot of times you don't have a tooth pain, and you don't have the swelling being caused by that tooth. Okay, you could have an insect bite in the area, which causes a skin infection, skin abscess, and you could get the same swelling. Now the tooth is not causing the infection, it's a skin infection. So it could present and look like this, although the etiology is different. Okay, and these need to be treated. Usually if it's related to the tooth needs to be extracted, and the area needs to be drained. Usually if it's from a tooth, it could be drained inside the mouth if it's not too far advanced into the facial spaces, and if it's not causing at that time airway issues. But this situation can become dire if it impedes in the oral airway. Okay, moving on to some common cases we as health professionals, oral health professionals see. Well, I'm going to talk about a virus. but it's a little different kind of virus than the coronavirus that has been dominating everything, the world right now. And this is your herpes virus. It's the herpes labialis virus. And this is caused by the herpes simplex 1 virus most of the time. There's contention from people that 75% to maybe even 100% of people are carriers of this virus. Now, usually when people say herpes, they think of other sexually transmitted diseases, because there's many types of herpes. This is all in the same family that causes chickenpox, mononucleosis. This is all in that family, but the herpes simplex 2 is a type that causes the genital lesions. Okay, herpes simplex 1 is the one that mainly causes oral and labial lesions. And what these usually presents as are tiny vesicles or that erupt and become blisters after they rupture. In and around the mouth, usually on the lips. Can be painful, very contagious, as I noted that some contend that almost everyone is a carrier. And usually you acquire these when you are an infant and you have Aunt Sally coming and giving you a little peck on the cheek, and she just gave you herpes simplex 1. Having said that, usually it resolves these in 1 to 2 weeks. You have these tiny blisters that rupture. Sometimes they could cause a fever, and sometimes in immunocompromised individuals they can become serious, possibly infecting the eye or the brain. But generally it has a pretty benign course, let alone having these blisters and the fact that it's contagious. Sometimes you do get swollen lymph nodes because of herpes labialis as well. A lot of people ask me, how do you prevent this from happening? You could use some antivirals like acyclovir, but that is if you use it early on in the course of the lesions. If they're used once you see the lesions and they have taken their time to appear, usually the antiviral ointments are not really effective, and you have to wait the course of the lesion to resolve. And of course you could spread it when you have the lesion as it sheds, but then again, maybe everyone in the world is a carrier of the herpes simplex 1 virus. Sometimes these happen in the mouth as well, as not just on the outside of the lips. And as I noted before, the sister lesion of the sister virus of this is the herpes simplex 2 virus, which generally causes the genital lesions, the blisters around the genital area. Now, what's confusing is that about 10% of the time you have the herpes simplex 2 virus that affects mainly the genital regions and genital mucosa, cross infecting the oral cavity. So there's a 10% cross infection, whereas the herpes simplex 1, 10% of the time can cause the genital lesions, and vice versa. But usually 90% of these lesions are caused by the herpes simplex 1. And at times, you get these often. People may get them often 3-4 times a year. And usually patients tell me that they feel a little tingling or a little warmth in the area where these lesions could present. And that is probably the time where you feel you're going to get it, to go and maybe get antiviral ointment like a cyclovir. But keep in mind, this is not an emergency either. It's once the oral health care professional recognizes this, most likely the thing to do is give it time, drink a lot of fluids, just palliative care until it goes away. Okay, let's move on to the next common oral lesion that I see. And a lot of patients come in and they say, yeah, I've had this bump in my mouth. It's been present for a while, maybe a couple weeks, couple months, and kind of grows slowly. Doesn't really hurt, but sometimes I bite on it and it bleeds and it hurts. Well, kind of looks like that. That is a benign lesion. It's a benign growth of fibrous cells. And it presents as a firm mass. Thank you, Valerie, for your hand clapping. Appreciate it. But this presents as a firm mass. Could be caused by, I ate a chip and bit my lip. Very, very, very non-traumatic trauma, as I like to call it. Something like accidentally biting your lip while eating a chip, and you get these growth of fibrous cells. Very benign lesion. Does it indicate an emergency? No, unless it's hurting, unless you keep biting on it and it bleeds. But usually these could wait. These could be wait, and what the healthcare professional does, be it a dentist or oral surgeon or periodontist, is usually excise these and send it to the lab to make sure that it is a fibroma. And that's basically the treatment. They can recur, but just keep in mind, if you have this and it's not bothering you, these are things that can wait till a later time to be treated. Moving on, we have another common bump that I see. Usually resembles a fibroma, the lesion I just discussed, but these are a little softer and a little bit movable and a little bluish, and usually affects children, and most always affects the inside of the lower lip as opposed to the inside of the upper lip. And these are called mucosals or mucus retention cysts. Without getting into the detailed histology of it, essentially you could have a minor trauma, like where you're eating a chip or whatever, or you bit on your lip again, and your salivary glands, your oral cavity has about hundreds of these little tiny salivary or split glands that produce saliva and let it out into the oral cavity. Now, from minor trauma, sometimes you could get a disruption of these glands or the ducts of these glands that lead to the oral cavity, and you could have a extravasation of salivary fluid into the tissue. And what happens is a fibrous capsule forms around that salivary fluid, or a true epithelial lining forms around that salivary fluid, and you have a true cyst at that time, which is called a mucus retention cyst. And it could present like this lesion. Soft, palpable, rarely hurts. Sometimes these rupture, but usually when they do rupture, they come back because, as I said, there's a fibrous sac or epithelial sac that's holding the fluid in, and it just regrows. A lot of times they do spontaneously resolve, and treatment is removal with excision or laser. Some oral surgeons do take these out with a laser. But does this constitute an emergency? Probably not. But then again, if you're biting on it and it's hurting you and it's bleeding, maybe, but usually these can wait. They do grow most often, but they can wait if you could tolerate them for the time being. Okay, moving on, we have something that's very common in the oral surgery, in our oral surgery profession, and this you'll know you'll have, because most of the times this causes pain, swelling, gum swelling or bleeding in the area, and this is a term called pericarditis, and it involves wisdom teeth. What happens is some wisdom teeth are fully in bone, some are fully out, but others are partially out. So there's soft tissue, there's gum tissue covering the wisdom teeth, which are third molars, of course. And sometimes plaque, food debris, or bacteria could get into the sulcus of where that gum tissue is over the tooth, and you have a trap. You have a bacterial trap, and you get pretty much essentially a gum inflammation, gum/infection. And these can cause pain. And if the infection spreads, you could get facial swelling. Usually they're accompanied by redness in the area, either outside the mouth if it's spread to your facial spaces, and these may cause fevers because they are essentially an infection. And this is an emergency, especially when it has caused swelling to the outside of the face, and it could possibly impede your airway. Usually the treatment for these types of lesions is to extract the tooth, the wisdom tooth, usually done by an oral surgeon. Sometimes dentists do perform wisdom teeth extractions. Also, a lot of the times, if it has led to facial space infections, you need drainage of the abscess, which may, depending on how severe it is, may have to be done in the operating room with full anesthesia, depending again on how severe it is. Okay. If you want me to elaborate on any more of this, just let me know, or you could direct message me afterwards, and I will answer any of your questions. Moving on, we have this lesion that I personally get a lot myself. It's a very common lesion, and you know when you have this because it's intensely painful. It usually presents as a tiny ulceration in the mouth, and highly painful disproportionately to the size of the lesion. And what this is, it's an aphthous ulcer. Cause, it's not known what causes these. Sometimes some experts say it could be a vitamin deficiency such as vitamin B. It could be caused by excessive sunlight. It may be caused by stress. But there are two things to know about this. It is extremely painful based on the size of it. They appear white because there's a pseudomembrane covering the ulceration, and they do have a red border because there's inflammation around the lesion that causes that redness in the oral tissue. Now, with these, they're not contagious and they're not cancer. So if you wake up and you have this really painful lesion that looks like an ulcer, has this white with surrounding red, know that you can't spread it and it's not cancer. Do they need treatment? Well, usually these resolve. It's not a fun course, but it takes about 1, maybe 2 weeks, and they resolve even without scarring. Now, there have been some proposed treatments for this, such as steroid ointments, which may or may not help. Don't see a very strong indication that those help, but they may in some. Rinsing with salt water or rinsing with hydrogen peroxide, questionable. It may help. Maybe dabbing it with silver nitrate, which we usually use to control oral bleeding. But then again, some it may help, some it doesn't. At any rate, this is a common lesion. It affects about 20%, probably more, of people, and affects me. I get these frequently, and usually their course is about 1 to 2 weeks. Don't need any surgical treatment for this. Now, if you could put some ointments or creams in the area and it helps, or you could rinse with certain hydrogen peroxide or salt water or whatever, or touch it with apply some silver nitrate on it. But usually these don't need surgery unless you're really concerned that they could be something and they have withstood their presence for about 2 weeks, longer than 2 weeks. Then maybe a biopsy is warranted. But if you see this, not an emergency. Okay. And now we're in our final common lesion. Now I'm kind of presenting a very limited scope of oral lesions, and these are just the common ones that I see frequently. We could go through many things that I haven't discussed, but this is just common lesions, and I see a lot of times I see females with this, what's termed the pyogenic granuloma. Now this is a little pretty much area of exophytic tissue on the gum area, usually between two teeth area, where it kind of bleeds a little bit too. It's red, it's firm. Sometimes pain, sometimes usually without pain, but it's just for the patient that has them, it's worrisome. So what these usually are, they usually occur in females. They're termed, some of the common past terms for them was a pregnancy tumor, because they usually occur when a female is pregnant. But what's happening is this is a benign tumor, and you get a little bit of minor trauma or irritation in the region, and you have these vascular channels forming with fibrous tissue and a little area of inflammation, and what's termed as a pyogenic granuloma. Now, sometimes these spontaneously resolve, such as when the pregnancy is over, and sometimes they don't. Definitive treatment is to excise them with either a surgical blade or with a laser. But generally benign. Do they need an emergency? Do they qualify as an emergency? Questionable. If they're not hurting or bleeding, you could wait to have them out. Sometimes I have waited until the patient's pregnancy was over, until they gave birth, to treat these, because they weren't causing any symptoms, and I didn't want to do a surgical procedure while they were pregnant. So one of the things to keep in mind, I mean, if you're a female and you're pregnant and you see one of these, it might not be too worrisome, although you do need to be seen eventually. Also, sometimes children, when they're going through puberty, they get these lesions, as these are hormonal, that could cause these, and hormonal or metabolic changes can induce these lesions and cause them to spring out, and they are benign. I think that should do it among these top oral lesions that I do see. Just trying to help out people, once again, if you just joined me, just trying to help out people at home that are concerned about some things going on in their mouth and in their oral cavity, and they don't have access, or they can't see a dentist or dental specialists or oral surgeon, periodontist, root canal specialist, what have you, right away because of the lockdown. I could, as I said before, I do work in the greater LA area if anyone needs anything urgent, and I am always open to questions if you want to direct message me. I will leave this presentation up in my post. Hope I helped anyone out. And be safe at this time. I have not experienced anything like this, and I've lived through a lot of things. I've lived through the LA riots, the Desert Storm, the O.J. Simpson fiasco, 9/11. This is just unprecedented, where basically the world has shut down. So very uncertain times. I'm hoping for the best. I think we will come out. I'm pretty much sure we will come out of this. How society will change after that, don't know. My pleasure, Brittany. Don't know what's going to happen, but I'm confident we will look back on this and go, oh, that was an interesting time. Look back at it like that. But do what the government does say and keep safe and keep your distances, wear a mask, wash your hands, and let me know if you have any questions. Just direct message me or let me know. Okay, thank you. Have a great day.